We did a presentation on marijuana and pregnancy last year, and we decided that we needed to repeat it this year because so much is happening and it's all going so fast. And I'm going to try to look at it from the perspective of prevention this time. We hear so much about people talking about the times in the 60s when marijuana was first becoming really popular and saying, well, there was nothing wrong with marijuana, using marijuana at that point. But a lot has changed since the 60s. And the marijuana today is much stronger than it has been over the last several decades. And the THC, the active ingredient in marijuana, the proportion of THC in a marijuana mix is steadily increasing. Just to give you an example, now the latest data we have is from 2008, but in 1985, the concentration of THC in marijuana was about 2.5%. By 1993, it had risen to about 3.5%, and then in 2008, it was 9%. Now that's nothing compared to some of the marijuana that is now being produced for sale, where you can, in some places in the country, find marijuana that is 30%, 35% THC. So you can see it's much stronger these days. The other thing that's changed is that over the last 10 years or so, the majority of the public has been feeling that marijuana should simply be legal, and the rate of the number of people that believe marijuana should be legal is increasing every year, because all in all, the public attitude toward marijuana is that it's a harmless drug. Now, the prevalence of use during pregnancy, the most recent data we have is around 9 to 11%. The 11% was from the SAMHSA study of 2012, and our own data from 2008 through 2012 using the 4Ps Plus was 9%. But here is some updated information. What we have now found is we went back, first of all, and looked at several counties in California. Now, all of these counties use the 4Ps Plus screen, and they all, I selected California counties because they all operate in the same way. They are all within the same general culture and environment. And what you see is the rate has dramatically risen in 2017. Marijuana first became legalized over this last couple of years in California. And you can see that it went from averaging around 14% in 2013 and 14. 2015 was basically similar. 2016 was about 13%, and the current rate of marijuana use during pregnancy in 2017 has jumped to 15%. So you can see there's been a marked increase. Now, as they say, correlation is not causation. We cannot lay this sudden increase in the rate of marijuana use solely at the foot of marijuana becoming legalized. But at the same time, legalization of marijuana engenders changes in attitude toward marijuana use in pregnancy. The best example of the impact of legalization of marijuana on maternal marijuana use is what we have seen in Colorado. Now, the measure legalizing marijuana was passed in 2012. It didn't actually become effective until January 2014. So there was a study done by the U.S. Drug Testing Laboratories. They're based in Chicago, but they do meconium sampling for states around the country. And they store all the meconium samples. And as you know, any drug the woman takes, any substance the woman takes during the third trimester of pregnancy can be found in the infant's meconium. So they looked, the U.S. Drug Testing Laboratories looked at meconium samples and searching for marijuana in the meconium samples. And the time periods they looked at were the first 9 months of 2012, which is when the legalization of marijuana was passed, but not effective. And then the first 9 months of 2014, when the law actually went into effect. And they looked at two groups of meconium samples. The first were meconium samples in 2012, 2014 in the state of California, and then meconium samples in 2012, 2014 in all the other states from which they had collected meconium samples. And their purpose was to compare changes between 2012 and 2014 between Colorado versus all other states. Now, what they found is in 2012, the overall rate of positive meconium samples for marijuana in Colorado and in all other states was about 10%. When they looked at the 2014 samples, the rate in Colorado had gone up to about 12%, whereas the rate in all other states had not changed. It remained at 10%. Now, although there was a change, an increase in the rate of positive meconium samples, this was not a statistically significant change. And so we can't say too much about that. However, when they looked at the concentration of THC in the meconium samples, the concentration in all other states did not change. It was about 200 nanograms per gram of meconium. However, in Colorado, the average concentration of THC in the meconium changed from about 200 grams in 2012 to a little over 350 nanograms per gram in 2014. This was a statistically significant increase in the concentration of THC in those samples that were positive for marijuana. So what this tells us is in the first 9 months after marijuana became legal, there was no significant increase in the rate of maternal marijuana use during pregnancy, but women who were using marijuana during pregnancy were either using more marijuana or more concentrated marijuana. Either way, the fetus is receiving a higher dose of marijuana. Now, the question is, so what? So what if a woman uses marijuana during pregnancy? Well, what you have to understand is that marijuana is highly lipid soluble, and the brain is made up of all lipids, which are fats. So that marijuana crosses the placenta and crosses from the blood to the brain. That's called the blood-brain barrier very easily. And so you get the majority of marijuana to which the fetus is exposed is concentrated in the fetal brain. The question is, what does this do to the developing fetal brain? Now, the pre-neuronal phase of brain development is a very vital aspect of fetal brain development. And it begins about 16 to 22 days after conception, which of course is much earlier than any woman knows she's pregnant. At that time also, the endocannabinoid system is developing in the brain. And as you can tell from the word endocannabinoid, those are the naturally occurring cannabinoids that are in the brain. And the endocannabinoid system is at a much higher density in the fetal brain than in the adult brain. Now, at this time, in this pre-neuronal phase, 16 to 22 days after conception, the basic structure of the brain is originating. Now, that basic structure includes the cerebral cortex, the outer shell of the brain, the amygdala, the hippocampus, which are part of the limbic system, the cerebellum, and the basal ganglia, also part of the limbic system. Now, those structures are important to remember because when we talk about the impact on the developing fetal brain, these are the parts of the brain that are most affected. In fact, if a woman uses marijuana during the first month after conception, the baby has a significantly increased risk for being born with anencephaly, which is when a baby is born missing the front part of his brain. And to remember, we said that the cortex is originating during that 16 to 22 day period. It's when the neural tube is closing during that first month of after conception. So we have a very vulnerable fetal brain exposed during the first month after conception to marijuana. The result being an increased risk for anencephaly. Now, the problem is, first of all, during this first month, most women don't know they're pregnant. And so to those women who tell me, well, yes, I smoke marijuana, but as soon as I find out I'm pregnant, I'll stop, I have to warn them that some vital structures can be harmed long before the woman realizes she's pregnant. We're going to get in now to some of the studies of marijuana and its impact on pregnancy. But these are very difficult studies to interpret at this point, and so we have to be very careful. If you look at all the studies I'm going to talk about, most of them consist of very small or highly selected samples. Data are not collected prospectively, that means all the way through pregnancy, but rather asking women how much marijuana they smoked during pregnancy and collecting that retrospectively. There often is a lack of control for potential confounders that can affect fetal brain development. In the United States, we have very high rates of polydrug use, and in fact, one of the ways in which women's substance abuse patterns differ from men is that women are polydrug users, while men tend to use just one substance. And then obviously, if we look from one study to the next, there are differences in study design. Looking at all of those issues, that's why I think this issue, published by Mohammed and colleagues in 2012, is by far the best study that we have. First of all, it's quite large. It looks at 24,874 unselected live births. And it is a prospective analysis in that they assess substance use patterns at the first prenatal visit. Now, the average age of the women in the study was 28 years. And what was found was that 26% of these almost 25,000 women had ever used marijuana in their lives. Almost 10% of them were regular users, and about 2.5% continued to use during pregnancy. So what the researchers then did was look at women who continued to use during pregnancy versus those who did not. And while they did this, they controlled for all the factors they could control for that we know can affect the outcome of the infants, including socioeconomic and sociodemographic characteristics, whether the women smoked tobacco, alcohol use patterns, and use of other illegal drugs. That being said, what they found is if the women used marijuana during pregnancy versus those that did not, there was a significantly decreased average birth weight, birth length, and gestational age. They also found that women who smoked marijuana during pregnancy versus those who did not, the women who smoked marijuana were significantly more likely to have a small for gestation age infant, and the infant was significantly more likely to be admitted to the neonatal ICU. So this study gives us the big picture. Now, there have been multiple other studies. Do they agree with this? And what you can see here, and I've purposely, along with the outcome information, I've listed the research articles that the information comes from. And on our website, and Gabe will explain this to you later, but we do have all of the references. So you can go to the website, click on references, and then click on references for marijuana, and you will find a full listing of all of these references if you want to gather any of them. So what these studies found was the great majority of studies have also found that marijuana has an impact on fetal growth, with the infants being significantly smaller. Now, there were 2 studies that did not show any impact on growth, but then again, you look at animal studies, and the animal studies also show a significant impact producing decreased fetal growth. So overall, it's fairly well accepted that marijuana use during pregnancy and of itself, controlling for all other factors, does produce an impact that lowers average birth weight. Another important study was a very large epidemiologic study of stillbirths. And what these authors found is when you controlled for all other factors, including tobacco smoke, which tobacco, of course, does have an impact on increasing rates of stillbirth also. But even when you controlled for tobacco use, women who used marijuana had about a 2 times increased risk of stillbirth. Now, given that the United States ranks 6th in stillbirth rates around the world, one has to get this information out to women that smoking marijuana during pregnancy can increase risk for stillbirth. Now, just as important, and perhaps even more important than the impact on medical outcomes, is the impact of marijuana use during pregnancy on neurobehavioral abnormalities. And let me remind you, neurobehavior is the way we interact with and respond to the world around us. And an infant, a newborn infant, does express neurobehavioral abnormalities when exposed to marijuana. If you look at all of these, habituation, sleep disturbance, state regulation, orientation, range of state, these are all related to the regulatory behaviors, that is, the ability to self-regulate. And then the most recent study in 2006, state regulation, arousal, and excitability. So all of this points toward regulatory difficulties, the ability to regulate behavior, regulate state of arousal. Now again, that's very important to remember as we look at long-term impact. I should point out, of course, that one study by Dreher, done in Jamaica in 1994, that's the study that everyone uses to defend marijuana use in pregnancy. Because, in fact, Dreher had no findings of neurobehavioral abnormalities. But what most people are not well aware of is this study only included 23 infants, many of whom that were exposed to marijuana actually were exposed to marijuana through the tea their mothers drank, not marijuana smoking. And of course, the Jamaican population is completely different from the US population and its patterns of use. So when you consider the Dreher study, you have to realize it really has no pertinence nor significant findings related to what has been found in all of these other studies. Now, the long-term studies all the findings consist of findings related to regulatory behaviors. So impaired cognitive and neurocognitive skills, and a lot of that is related to the ability to focus, concentrate, to manage behaviors. And all of these studies that are listed to the right found difficulties with cognitive, neurocognitive, and/or deficits in behavioral functioning. Animal studies have also shown that there are memory deficits and hyperactivity, which of course is a form of regulatory behavior. Day and her colleagues found that if an infant was exposed to marijuana prenatally, when you control for all other risk factors, there was an increased risk of marijuana use during adolescence. And I think the most telling story is a study of functional MRIs in 18 to 22-year-olds. So what they did was they performed functional real-time MRIs in a group of 18 to 22-year-olds who had been exposed prenatally to marijuana. Again, when they controlled for all factors, they found that the functional MRIs showed or demonstrated altered neural functioning, especially having an impact on short-term memory. So I think there is very good evidence of the long-term impact of marijuana. And overall, when you put all of this together, Freed conducted an analysis of multiple studies, and what he found was the final common thread. Again, when you control for all factors, the common thread of altered neural behavior was on executive functioning. So that adolescents who had been prenatally exposed to marijuana had changes, deficits in executive functioning. Executive functioning is the ability to plan and complete a task, to think ahead, to understand the consequences of behavior. Executive functioning is vital to long-term academic and social and life success. So in summary, the argument that marijuana is a harmless drug just isn't true. Because we know it crosses the placenta and accumulates in the fetal brain, it interferes with neuronal cell development in the fetal central nervous system, and animal studies document many of the same effects as human studies. The important point here is we have got to get this information out to the public. But why is prevention so difficult? Well, first of all, there are a lot of opinions. And in this day and age in the United States, we see a lot of people acting through opinion rather than facts. And so many of the opinions that we have to deal with are uninformed as well as informed. The politics of marijuana intercede with thoughtful discussions. Again, that goes back to the opinions, but it also comes down to the fact that states that are legalizing marijuana are making a lot of money off of marijuana sales. And so it's very difficult to have a thoughtful discussion. The science is relatively new and contradicts many of the earlier well-publicized studies, especially the Dreher study that I mentioned earlier. And most importantly, all of this comes together so that laws are being made before we really understand the public health implications of those laws. Now, as we prepared for this webinar, we started getting questions sent to us by several different people. And so I've recorded the questions word for word here. This question came in. Many of our obstetricians tell mothers they can smoke marijuana for nausea. It's still legal in our state, and that it will not affect the fetus, and the baby will not experience any kind of withdrawal after birth. We are seeing differences, I think is what was meant, in some babies. Our pediatricians, for the most part, do not want to deal with that aspect. What is the best way to educate these professionals? Well, it is very difficult. And again, we have to rely on fact. The best way to get to professionals in the way in which they are most used to getting information, first of all, is by publishing articles. And you might want to go to our website and request the article we recently published on marijuana and pregnancy. We are glad to provide that article to you free of charge. We can't post it on our website because of copyright laws, but if you email us or contact us through our website and request the article, we'll be glad to send it out to you. The second way that physicians get information most directly is through grand rounds. You need to have a grand rounds presentation. Now, the difficult aspect of this is to get doctors to listen. You have to have a doctor present the information. So you're going to need to find a local champion, physician champion, who can take this information that I presented to you today and present it to his colleagues. The third way is to begin to work on changing attitudes with the public and providing fact-based information. So what I have here, many physicians don't want to get into this discussion, but this is one of the brochures we recently produced, and it has 10 basic facts about marijuana use in pregnancy. It's written in very simple language. It comes in both English and Spanish, and physicians can simply hand this brochure out. Now, many patients will take a brochure, but they won't go home and read it. So, what's the next step? We have to engage the patients. And how do we engage people in these days? It's through multimedia. And so the other thing we've produced are animated videos. This is an animated video titled Marijuana Use in Pregnancy. This is just the front piece of it. I can't show you, the webinar system doesn't allow us to show videos, but it's about a 2-minute video. It comes in English and Spanish. It's stated very simply and clearly and goes through a lot of the information designed for the public. And the nice thing is, you can put this either on a reel that shows out in the physician's office. You know, many physicians and WIC programs have a TV where videos are being shown, or you can download it to your iPad or smartphone. And I have found it most successful when a woman asks me a question about marijuana use in pregnancy, on my smartphone or on my iPad, I can show her this very brief, clear video. And again, in Spanish and English. So you can go to our website and look further into that. Another question that came in is about marijuana use and breastfeeding. So let me go back to one of the things I said about marijuana. Marijuana is highly lipid soluble, so it crosses very readily into the breast milk, which is made up of a high fat content. So what do we know? It does transfer into the breast milk because it's highly lipid soluble, and THC, the active ingredient in marijuana, is very quickly absorbed. And then the THC, because it is so lipid soluble, can be stored in the fat content of breast milk for up to 2 weeks. And in fact, chronic heavy use of marijuana results of higher levels of THC in the breast milk than in the mother's blood. So, bottom line, absolutely you cannot smoke marijuana and safely breastfeed. Secondhand smoke, I wanted to throw this in because just like nicotine, babies will absorb significant amounts of THC if someone is smoking marijuana around them. Now, why is exposure through breast milk or through secondhand smoke so important? Because from the 3rd trimester of pregnancy through the 1st year of life is the most rapid period of brain growth and development. And during that time, exposure to marijuana can have potential impact on the developing infant brain. So what is our message? No amount of marijuana is safe to smoke during pregnancy or while breastfeeding, and you must protect your infant from secondhand marijuana smoke. The effect of marijuana on the supply of breast milk, it does reduce breast milk supply. And what has been shown through several different studies is that if a woman is smoking marijuana and then breastfeeds the baby, you see lethargy, infant weakness, and a poor suck. So it interferes with the baby's ability to feed. Animal studies have shown changes in the structure of brains of newborn animals exposed to marijuana through their mother's milk. And one human study showed that marijuana exposure through the breast milk in the 1st month after delivery had a negative impact on the infant's motor development at 1 year of age. And these points just underline the importance of educating women about marijuana use during pregnancy and during breastfeeding. So what advice should you give to the new mother? Not only should she abstain from marijuana use during pregnancy, but also during breastfeeding. Protect the infant from secondhand smoke in the same way we protect infants from tobacco smoke. If the mother insists that she's going to smoke marijuana but only occasionally, she should store some unaffected milk. And if a woman is smoking marijuana, she should hand the baby off to another caregiver who's not using while the mother is using marijuana. Because when someone's high on marijuana, they can make some very bad decisions that could prove dangerous to the infant. And then this is a very interesting question we got. I saw a TV show just the other day that said that there really is no problem with using marijuana during pregnancy. Is that true? Unfortunately, I saw the TV show. Even more unfortunately, I was asked to be interviewed for the show. The producers assured me that this was going to be a TV episode that really emphasized the science of marijuana use in pregnancy. The final product, however, was very short on science and told a very involved story of a woman who smoked marijuana during pregnancy because of chronic pain. The producers then came down to these conclusions. Number one, marijuana use during pregnancy is probably safe because look at cocaine use in pregnancy. That's been shown to be safe also. Now, we know that cocaine use in pregnancy is not safe. And while the producers of the TV show said that long-term studies have shown no effects on children exposed prenatally to cocaine, that's just not true. So both the immediate neonatal effects, infant effects, and long-term effects of cocaine are clear. But they use that as an example to say that marijuana is the same. They then ended the story showing a very healthy newborn infant, which many infants do in fact look quite good at birth with only very subtle changes in spite of their mother's marijuana use in pregnancy. However, the data are fairly conclusive that there are long-term effects. And as the child and adolescent becomes more developmentally challenged, both academically and socially, over the long term, that's when the long-term effects of marijuana show up. So we have a responsibility to take this information and use the scientific facts to help people understand the impact of marijuana use. From a practical practice perspective, I think you need to consider marijuana in the context of alcohol and tobacco. Yes, it may be legal, but no amount of marijuana, no amount of alcohol, no amount of tobacco is safe to use during pregnancy. And before a physician prescribes medical marijuana, he or she should educate the woman about the impact of marijuana on pregnancy and the child, ask about the possibility of a current pregnancy, and I do feel that all physicians and nurses should offer pregnancy testing to all women of childbearing age prior to giving them a prescription for marijuana. Now, these policy recommendations are part of a much larger public health recommendation, and I do, based on scientific fact, I do feel that medical marijuana legislation in each state should include requirements for public, professional, and legislative education about the impact of marijuana on pregnancy and the child, that all sites that prescribe or sell marijuana should have information materials, and that a government warning label, similar to alcohol, regarding marijuana use in pregnancy should be part of every state's legislation. It's only through these very proactive steps that we're really going to have any impact on educating the public and protecting infants. So thank you very much. I hope my hoarse voice didn't disrupt your understanding. Thanks so much.